Hello everyone, I'm Dr. Lim from KB Lim Skin Clinic. This video is on HIFU, which is short for High Intensity Focused Ultrasound. Sound waves can be divided into infrasound, acoustic and ultrasound waves. Acoustic waves are audible to the human ear, whereas ultrasound is not. It is audible to some animals. It is used mainly in chemistry, in medical instrumentation, and for medical imaging purposes. In the case of HIFU, we use ultrasound between the frequency of 4 to 10 MHz, as shown. As students, many of us may have played around with a magnifying lens, trying to focus the sun's beam to a point to burn a dried leaf or to burn a piece of paper. In the case of ultrasound, we're using transducers to focus ultrasound to a point. So this is how HIFU works. HIFU delivers focused ultrasound. Focusing is important because it allows us to bypass the surface of skin so as not to burn it, but to heat the deeper tissue in the skin, including a layer known as SMAS or SMAS, which I will discuss in greater detail later on. When heat reaches the dermis, it causes areas of thermal damage. The temperature there approaches about 65 degrees centigrade. At that temperature, collagen is denatured and collagen also shrinks. Collagen denaturation stimulates a process of new collagen formation known as neocollagenosis, and also stimulates remodelling, which leads to reduction of wrinkles and fine lines. As mentioned, collagen shrinkage, which is due to the effects of heat on collagen fibers, causing them to shrink, as well as due to the production of new collagen and the remodeling process. They all work together to cause the skin to tighten and to give the skin a bit of a lift. Here in this figure you can see the different transducers. These are the three most common transducers used in HIFU treatment, with penetration of 1.5, 3 and 4.5 millimeter into the skin. 1.5 millimeter transducer allows ultrasound to be focused into a point at the level of the superficial dermis. With 3 millimeter, it reaches the deep dermis, and with 4.5 millimeter, it reaches all the way down to a layer known as SMAS or SMAS, which stands for superficial muscular aponeurotic system. This layer is very important because it acts as a suspension for skin tissue, holding the skin up and preventing drooping. This layer is normally only accessible through surgery, like in the surgical facelift where you cut the skin in order to reach the SMAS layer. In the case of HIFU, it is able to do this without having to cut the skin. So HIFU can really be considered as a truly non-surgical facelift. So how is HIFU different from other methods of non-invasive skin tightening? Non-invasive means there is no cutting or piercing of the skin, so it's a non-surgical facelift, as if you like. Now, all these non-invasive skin tightening procedures reach the dermis to stimulate collagen regeneration, but most of them are only able to reach the deep dermis, and HIFU is the only one that can reach the SMAS layer, which, as mentioned, is important for skin tissue suspension. And this is normally accessible through surgery. So it is the only equipment that does this, and it does so without having to do any surgery. So it is, as mentioned earlier, a good alternative to a surgical facelift. There are many different types of HIFU machines, the most well-known of which is Altera. There are other HIFU machines. They all work in the same way. The difference is in their branding. So what are the benefits of HIFU? HIFU tightens the cheeks, it tightens jowls, sagging neck, it improves the jaw contour and gives it a younger look. It tightens the décolletage area on the chest. It reduces fine lines, wrinkles, rejuvenates skin, smoothens the skin, lifts brows, sagging eyelids, drooping mouth corners and cheeks, and it also reduces double chin. So who is suitable for HIFU? Generally, it is best for patients who have mild to moderate skin laxity with still good elasticity. Elasticity means that if you pull on the skin and release it, the skin goes back to its original state very quickly. So it's best for people with mild, moderate skin laxity and good elasticity. It is not so good for people with severe laxity and loss of elasticity as seen in patients with a turkey neck deformity. So the other advantage of HIFU, as mentioned earlier, is it is non-surgical. It is non-invasive. There's no cutting, there's no piercing on the skin, there's no downtime, there's no pain. So it is also suitable for patients who are more pigmented and of darker complexion, because this treatment is not affected by color of the skin, and it also can be used the whole year round. So it's ideal for people with mild to moderate skin laxity who do not think they need a surgical facelift. There are some contraindications to HIFU. The main ones are patients who have metal stents and implants in the areas that we are treating. The other contraindications are merely precautionary. Generally, given that HIFU is a cosmetic treatment, treatment should be delayed until the problem can be solved or has resolved. So patients with active systemic or local skin diseases, severe cystic acne, open wounds on the area, pregnant women, breastfeeding women are generally best treated only after everything else has gone back to normal. Patients with bleeding disorders who are taking blood thinning drugs are best not treated because they may encounter quite a bit of bruising. Patients with cancer patients are usually not treated merely out of precaution. So HIFU treatment is a simple procedure. Basically, the patient is positioned on the couch, the skin is cleansed, ultrasonic gel is applied to the skin so that the handpiece can move smoothly over the skin without causing any discomfort. The handpiece is placed firmly against the skin and the ultrasonic shots are delivered. The sensation is often described as a warm sensation. Some patients will feel a mild discomfort, often likened to tiny electric pulses or prickly sensation. Areas around the eyes and over bony prominences may be a bit more sensitive. However, topical anesthesia is usually not required. As for the treatment duration, it takes usually about 30 to 60 minutes on the face, but if we're treating larger areas such as the face, neck, and the décolletage area on the chest, the treatment will take longer. You can expect slight redness or swelling. Some patients will experience some tingling or aching or numbness, which is short-lived. Most importantly, there is no downtime, and this is a feature of all non-invasive skin tightening procedures. And there is no need to take any special care of the skin after treatment. And as for the number of treatments that are required, generally most patients require 1 to 3 treatments, and this is usually given around 3 months at about 3 months intervals. The number of treatments really depends on the severity. Because HIFU treatment is a non-invasive skin tightening which depends on new collagen formation, the results are usually not immediately evident. It usually appears after 3 months when new collagen is formed, and then because of the remodeling process that continues thereafter, the skin continues to improve for the next 6 months. The results can last up to a year, but generally I recommend 6 to 12 month treatment touch-ups. This is to keep pace with the natural aging process. If you wait for a full 12 months, then the initial benefits may have disappeared and you have to start all over again. At 6 months, you can still build on the benefits that were achieved from the previous treatment and thereby maintain a better result. A lot of patients are worried that skin tightening treatments may alter the facial appearance. It does not, because if you remember, HIFU stimulates collagen regeneration. It doesn't alter the structure of the skin. So the improvement is very natural. With a surgical facelift, if it's overdone, some patients may develop a kind of pullback appearance, which is not natural. Because HIFU is non-invasive, it can be combined with other treatments such as fillers to correct volume loss, Botox to reduce expression lines. Because of its different levels of combination, we sometimes combine HIFU with IPL or BBL light, or we combine it with radio frequency. BBL and radio frequency is described in a separate video, and the links will be provided in the description below. So I hope you enjoyed listening to this video. Please visit my website at www.kblimskinclinic.com to watch all our educational videos. We have many of them, and also to read about common skin problems such as acne, eczema, psoriasis, rosacea, pigmentation. So I'm going to leave you with a short video on the HIFU treatment. I hope you've enjoyed this presentation. Thank you for watching, and I hope to see you again. Goodbye. Same thing here.
How's it feeling?
Okay.